for Alberta. Dr. Inchab will provide a brief update and then we will open the floor to questions.
Thank you, Tom. Good afternoon. Today I am pleased to report that 6,501 Albertans have recovered from COVID-19, leaving 400 active cases in the province. Currently, 53 people are hospitalized with COVID-19, with 6 of these in ICUs. In the last 24 hours, out of 2,709 new tests, there were 34 new cases. No new deaths have been reported. We are monitoring an increase in active cases in the Edmonton zone. Many of the new cases can be traced back to 2 private family gatherings. I commend the individuals involved for getting tested as soon as they felt symptoms. This has helped us trace and limit further spread of the infection. Outbreaks such as this one linked to social gatherings are not completely unexpected now that our gathering restrictions have been relaxed. But I must stress that we have the ability to prevent such cases by continuing to follow public health measures when gathering. You must still keep 2 meters apart from anyone outside your household or cohort family. I would again urge you not to share food or drinks with people outside your household or cohort family, as this greatly increases the risk of infection by passing objects such as containers or serving spoons from person to person. I know it may be difficult or even seem rude to ask guests to bring their own food and drink and not share it, but it is necessary. Outdoor gatherings have a lower risk than indoor gatherings, so if you are getting together with those outside your household or cohort family, stay outside if possible. Finally, like this group did, it is critical to go for testing with even minor symptoms that could be related to COVID-19. And if anyone is feeling ill, do not attend a group gathering. I note that expanded testing access means that you can go online to book your own appointment at a time that is convenient for you. We must not shame those who test positive for COVID, but rather support those who need to be isolated if they have the infection or if they've been in close contact with someone who has. Only by working together can we stop the spread, and the success of our relaunch depends on all of us doing our part. We need to continue to follow all public health orders and guidance so we can continue moving forward. I want to highlight a success story that showcases the power of collaboration to stop COVID-19. You may recall several weeks ago, I mentioned that the Mountain View poultry plant had a confirmed COVID case in the workplace. Thanks to decisive and swift action by the company and public health to put measures in place to prevent spread and offer widespread testing to employees, that outbreak was contained to only 5 people and is being declared over today. This is a great example of what we can do together. I also want to remind all Albertans that testing is now available to everyone, whether they are experiencing symptoms or not. You can book a test by completing Alberta Health Services' online self-assessment tool, and I encourage all Albertans to participate in our population testing to help us better understand our prevalence as we prepare for Stage 2 of relaunch. Today, I would like to talk about seniors, the age group that has been hit hardest by this pandemic. This week is Seniors Week, when we recognize the seniors in our lives and celebrate their contributions to our province. Seniors have played a valuable role in building our communities. Their knowledge and experience is invaluable, and this week is an opportunity to celebrate their contributions to society and connect with and learn from them. Of course, Seniors Week this year is difficult. We have to find ways to reach out to the seniors in our lives while maintaining physical distance and taking other precautions to keep each other safe. Both the COVID-19 pandemic and our aggressive public health measures to limit the spread of infection have been particularly hard on elderly Albertans. Individuals in this group are more vulnerable to severe outcomes from the virus. 138 of the 143 people in our province who have died from COVID-19 have been age 60 or older. We have lost friends, neighbors, parents, and grandparents to this pandemic. Each loss is felt deeply by loved ones and communities. The strict measures we have put in place at continuing care facilities are necessary to protect vulnerable people from this dangerous virus, but they have made many residents feel more isolated and lonely. I thank all Albertans who are working hard to make sure the seniors in their lives, whether they are in a continuing care facility or not, feel connected to their friends and families. I also want to thank continuing care staff for all they do to keep residents safe and ensure they receive proper care. And I want to thank seniors who have gone the extra mile to check in on their friends who may be feeling lonely or need extra support. As we proceed with our relaunch, these efforts will continue to be necessary. While some restrictions have been lifted, things are still different. Seniors may now be able to visit more freely with their loved ones, but physical distancing requirements still limit interactions. Measures taken to keep our loved ones safe may present additional hurdles to those visits, such as the challenges physical distancing provides to those who are hard of hearing. Some seniors may still be fearful of going out or visiting with others. We need to respect these concerns and continue to do what we can to ensure the needs of our elderly loved ones are met. This Seniors Week, I encourage all Albertans to reach out to the seniors in your life, offer to run errands for them if they need this, provide much-needed companionship in whatever way is possible and safe, and support them in whatever way is necessary. However you choose to mark Seniors Week, please share your experiences on Twitter using the Alberta Cares hashtag. We must continue to take all necessary steps to protect the health of vulnerable Albertans, and take the time, particularly this week, to recognize the contributions that seniors have made and continue to make to our communities, our province, and our country. As we move forward and restrictions are lifted, things will get easier, but we must remember that the new normal is not the same as the old. We must remain committed to supporting each other both to stay safe and to stay connected. Thank you, and I'll be happy to take questions.
All right, we'll go to the phone now. Operator, can you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
It's been a few weeks since phase one. What has the full impact of phase one been, and what lessons can we take away as we prepare for phase two? Also, in regards to the active cases that you're looking at in Edmonton, how many cases can be traced back to these two private family gatherings?
So with respect to lessons learned from stage one, I would say that on the whole, Albertans have done well, that our numbers have remained low, which is encouraging. I do think, though, that as we've moved into that relaunch in stage one, what I believe from what information I've received and from what I've seen is that initially people may have been a little bit cautious, but as our numbers have remained low, I wonder if there is a bit of a feeling that we can leave the restrictions behind us and not worry about COVID anymore. And I wonder a bit about the recent bit of an uptick in numbers, if that's a reflection of a feeling that COVID is over, that we're past COVID. And so I think one of the lessons learned, I would say, in what we're seeing right now with just a little bit of an uptick is to remember that the new normal is not like the old, and that we have to keep protecting each other, and that is what will get us through this, is moving into relaunch and being able to open more things. And we know that we need to support all aspects of people's health, which includes social, it includes employment, it includes being able to connect with people. We also need to protect each other from the infectious disease risk of COVID. It has not gone away. So again, I think one of the key lessons is balance, and we continue to strive for that balance of being able to have the protections from COVID that we need, and also being able to have the interactions, the employment, and the opening of society that will support all aspects of health. The final question about the number of people infected. So at the moment, it looks like we know of 10 cases linked to these gatherings, but investigations are continuing to be underway, so we'll see if there are more cases that are identified.
Operator, can you put through the next caller, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Just wondering if we can get an update in terms of hospitalizations and ICUs, not so much in terms of the numbers, but just in terms of kind of this steady level that we've seen over the last week or so, and we haven't seen that decline that we saw maybe a couple weeks ago. Again, is that something that we're keeping an eye on?
We are, absolutely, and hospitalizations are a measure of transmission that was happening about 3 weeks before people are admitted to hospital. So it's a lagging or a slower indicator of older transmission. So we're looking at cases, we're looking at the behavior patterns that we're seeing, and part of a kind of proxy for that is what kinds of complaints we're seeing coming into the Alberta Health Services Environmental Public Health complaints line. Those have been fairly steady. Our cases have been relatively steady, although, as I mentioned, we're seeing just a slight uptick today in terms of the 35 cases. So we do continue to watch those hospitalizations closely. Again, there was a little bit of a rise a few days ago where we went from in the 40s to in the 50s, but it's been relatively stable. So again, just a reminder that it's in our hands. All of us as Albertans, it's in our hands to keep those numbers running stable and not increasing.
Operator, can you put through the next caller, please?
Next is Camilla DiGiuseppe with CTV. Go ahead, Camilla.
Thank you very much. Hi, Dr. Hinshaw. My question for you is, today in Calgary, we saw a lot of people, numbering in the thousands, protesting throughout the city. And from our observances, people were not necessarily keeping 2-meter distance, although many were wearing face masks or face coverings. But is there a concern, because there are 2 more planned events this week where there could, again, draw more of these large crowds? Are you concerned that these events could be super spreaders of COVID-19?
So any event where people are gathered together has the potential for spreading COVID. And so it's important whether people are exercising their democratic right to protest, or whether people are gathering with family, or whether people are attending an outdoor gathering of any nature, that as much as possible we are all protecting each other by making sure that as much as possible that 2 meters of distance is observed. And where there is a challenge in maintaining that face masks are worn by as many people in attendance as possible. So again, I think that really this would be one more example of where we would be reminding people to take those measures to protect each other and to work together to prevent spread in that setting as in any other setting.
Operator, can you put through the next question, please?
Next is Chelsea Kemp with, not sure the location, but something Eagle. Sorry, Chelsea, please go ahead.
Hi, it's the Cochrane Eagle. Hi, Dr. Hinshaw. Thank you for taking my question. Last week it was said there's a possibility recreation centers in the province could reopen earlier than anticipated. Based on case numbers and hospitalizations, is it possible community sports centers could open before September, or as part of stage 2 of relaunch?
So we are looking at recreation, sport, and fitness as a group of different kinds of activities, and then the locations that are associated with those as possibilities. A final decision has not yet been made, and so that's under discussion this week to determine which activities could be possible to start sooner than stage 3. So there will be more information coming later this week on a final decision about that. Whether or not a decision is made from a provincial perspective, just like for businesses, any operator of any kind of facility would have to look at the guidelines that are required to be met, and any kind of opening of any activities, just like with businesses, with recreation and sports, there will be public health guidance and some restrictions to prevent the spread of disease. And so each operator of those kinds of facilities would have to look at that and decide if they're able to comply with all of those, and if they're wanting to open. And so those are the kinds of 2 pieces that would have to be met. First of all, a decision that we would proceed, the public health guidance, and then operators deciding if they want to open or not with the restrictions that are in place.
Operator, could you put through the next question, please?
Is Laurent Perreault with Radio Canada. Go ahead, Laurent.
Hi. Hello. You mentioned earlier that you wonder if there's a feeling that we can leave restrictions behind us now. On top of the numbers, what else leads you to think that?
Well, just a personal anecdote. there was a very loud party in my neighborhood on the weekend. And so when I called to ask for some help with that, there was a delay of quite some time before getting through to an operator. And they told me that the noise complaints across the city for loud parties were very significant. There was a substantial increase in them. I haven't spoken with the police about whether that's unusual for this time of year or not, but it seemed to me that, plus the fact that we're getting reports of other outdoor locations where there have been large numbers of people gathering. And I think that, again, it's quite natural. The weather's nice. People want to be outdoors. They want to be with friends. But I do wonder if, because of our low numbers, we're in some ways a victim of our own success. So again, want to remind people that COVID will be with us for months to come, and we need to continue to take action to stop the spread.
Operator, can you put through the next question, please?
Only other question we have is a follow-up. Are we taking any at this time or no?
Sure, certainly. Patch her through.
Go ahead, Camilla.
Okay, great. Thank you again. Dr. Hinch, another question we have here is how long do you foresee social distancing will be with us? Will you be recommending social distancing until there is a vaccine? And what about things like contact sports? Would they be even possible before there is a vaccine? Thank you.
So, unfortunately, the only protection we have against COVID right now are the measures we take to prevent spread from one person to another. And depending on the context, the most important measures are things like having people who have any kind of symptoms, who aren't feeling well, having them stay home, get tested, and stay away from others if they do have COVID until they're no longer infectious. So that is absolutely a foundation. There's also the measures like if we can't keep distance from each other, if we're all feeling well and out in public, wearing masks when we're a little closer to each other than that 2 meters is a way of minimizing, but again doesn't replace the need to try as much as possible to stay that 2 meters distanced. And we will, unfortunately, have these measures in place until we do have vaccine or very effective treatment that would mean that people who get infected would not face the severe outcomes or consequences that we see now with the proportion of patients who are most vulnerable to that. And with respect to sports, we are looking at whether or not there are certain things we might be able to do to mitigate the risk of large transmission events. We're looking at whether or not we could modify sports. So currently in stage 1, we do have guidance about being able to do practices and drills and skill building exercises while remaining distanced. And we are considering what kinds of options we might have to lower the risk of sports in the future. But again, final decisions haven't been made. These are all trade-offs, trying to figure out how to minimize risk while at the same time making sure that we have the opportunities for people to maintain physical, mental health, and kind of that whole health experience.
All right, that is all the questions we have today. So thank you for tuning in, everyone. We'll provide another update on Wednesday afternoon.